Bore da, a chroeso. A cyn I fi ddechrau, dwi'n siŵr bydd pobl ledled Cymru yn ymuno gyda fi I anfon ein cydymdeimladau dwysaf at y Prif Weinidog yn dilyn marwolaeth sydyn ei anawrai Clare. Mae Mark wedi arwain yn gwlad ni drwy un o'r cyfnodau anodda yn ein hanes. Mae arweinyddiaeth gref wedi bod I raddau heleth oherwydd cefnogaeth cadarn Clare, a byddwn ni bob amser yn ddiolchgar iddi amdano. Mae'n meddyliau ni gyda'r Prif Weinidog a'i deulu yn ystod y cyfnod anodd yma. Morning and welcome. To start today, I'm sure people all across Wales will want to join me in sending our deepest condolences to the First Minister following the sudden passing of his beloved wife, Clare. Mark has led our country through one of the toughest times in the history. His strong leadership has been in part thanks to Clare's steadfast support, for which we will all be grateful. Our thoughts are with the First Minister and his family at this very difficult time. Diolch yn fawr. Today, the Cancer Services Improvement Plan has been published by NHS Wales, with 1 in 2 of us developing some form of cancer in our lifetime. Cancer will touch all of our lives at some point. For those people who develop cancer, we need to ensure we have the quality services in place to support them and to treat them quickly and appropriately to maximise positive health outcomes. I asked the NHS to come up with a 3-year plan to improve cancer performance in Wales, from investigation and diagnosis through to treatment and end-of-life care. The Welsh Government is already investing a huge amount in cancer. Over the last decade, spending on cancer care has nearly doubled. Last week, I announced £86 million for 10 new state-of-the-art radiotherapy machines and a new radiotherapy unit based in Abergavenny. We're also investing in robotic surgery, new breast centres of excellence, reducing the bowel screening age range, and the rapid rollout of rapid diagnostic centres. We've increased our training budget for the 3rd year in a row, which includes an increase in higher training places for oncology and radiology. Over the past 20 years in Wales, the 1-year survival rates for cancer has improved from 66% to 73%, and the 5-year survival rate has improved from 51% to 58%. Our mortality rate for cancer has decreased from 328 deaths per 100,000 in 2014 to 267 deaths per 100,000 in 2021. In the most recent Wales Cancer Patient Survey, 92% of respondents rated their treatment at least 7 out of 10, and 45% rated it as 10 out of 10. The number of people having investigations and being told they don't have cancer each month is at record levels at around 15,000 people. We are making progress, but we know performance must improve. We've changed the way we measure performance of cancer services so it can be a more useful tool in improving performance. Our primary target is that 75% of patients requiring cancer treatment should start definitive treatment within 62 days of the point at which cancer is first suspected. But we are currently way short of that target. Demand is growing, our capacity struggles to keep pace, and we're now much better at accurately counting everyone on a cancer pathway. That translates into the cancer performance we see reported, which has been far below our expectations since this new way of measuring performance was introduced. It's fair to say that the pandemic has had its impact too, distorting access and creating huge pressures in the wider system that has had implications for cancer investigations and access to theatres and critical care. Things are very, very difficult at the moment, with services working flat out to meet the needs of patients. But I am pleased to report NHS management data shows a fall in the number of people waiting more than 62 days for their treatment in the run-up to December. A fall in the overall number of people waiting on the cancer pathway, and slight improvements in cancer performance in the latest figures published for November. This shows the NHS is giving cancer pathways the focus they deserve, although the disruption of Christmas, industrial action and respiratory illness will cause us further challenges in the future. The Cancer Services Improvement Plan sets out how health boards will continue that focus on cancer. It focuses on preventing cancer, diagnosing it earlier and faster, treating patients with the most effective treatments and supporting them and their carers through and beyond this cancer pathway. The plan outlines how national cancer waiting times for treatment will be reduced through one-shop diagnostic models, the use of technology and innovations, and collaboration across health board boundaries. It describes what the NHS and its partners in Wales will do to improve the delivery and accessibility of effective cancer treatments, including surgery, radiotherapy, systemic anti-cancer therapy, and supportive care. The Cancer Improvement Plan also outlines plans for national guidance for patients who are living with cancer that cannot be cured or who are dying from cancer, to ensure that they receive an improved standard of individual, personalised, and where necessary, end-of-life care. Healthcare professionals across Wales, cancer patients, wider stakeholders, Welsh Government and the Wales Cancer Alliance have all collaborated to support the production of this plan. I'll now take any questions you have. Diolch yn fawr. I'm going to start with Dan Bevan.
Thank you very much, Minister. Good morning. The main point of the plan is essentially to maintain the current levels for some time, as to a point where you can start to reduce them. But already patients are not getting the kind of care that they deserve to have. And that was the case arguably before the pandemic. So is the pandemic now still an excuse for you on these waiting times? And essentially, you need to go quicker, don't you, to get through these waiting lists?
We absolutely need to go quicker. And what we've done here is to work with the experts in the field to come up with a really comprehensive approach, a 9-point plan that looks at the whole gamut of what we need to be considering, from prevention. And let's not forget that between 30 and 50% of cancers are preventable. So there is an issue there. We also need to make sure we have early diagnosis, faster diagnosis. We are absolutely focused on elective care recovery. This is one of the 6 priorities that I've set for health boards for next year. We want to see consistency in terms of quality across Wales. We want to see effective treatments and obviously end-of-life care where that is appropriate and necessary. And a focus really on improving that patient experience is also key for us, and making sure that we focus on the workforce and making sure that together we deliver that service across all of those priority areas. But it is a plan that is owned, that has been developed by and with the NHS.
As well, sorry.
Wel, diolch yn fawr. Wrth gwrs, i ni yn ymwybodol bod angen i ni wneud lot fwy yn y maes yma. Dyna pam i ni wedi gweithredu'r cynllun yma, dod lan gyda'r cynllun gyda'r NHS i hunain, gweithio gyda arbenigwyr, edrych ar pethau fel sut mae atal cancer yn y lle cyntaf, mae tua 30 i 50% o cancers yn preventable. Mae eisiau ni edrych ar diagnosis cynnar, edrych ar rapid diagnosis, sut i'n mynd i gynyddu y niferoedd sydd yn cael y gofal maen nhw angen o fewn yr amseru. Sicrhau bod yna gysondeb o ran y math o ofal maen nhw'n cael, a sicrhau bod ni yn defnyddio y technoleg a'r cutting edge technology sydd eisiau yn y maes yma. Felly gobeithio fydd rhaid ni gyd yn cyfrannu at y profiad mae'r claf yn cael.
If I could turn the attention to the strikes next week, they're set to be the biggest in the NHS's history. Even with the minimum staffing levels and the other measures that you're putting in place and discuss with the unions. I mean, there's no way, is there, that you can guarantee that not a single patient is going to come to harm as a result of the lower level of care that's available on those days, can you? And again, in English and Welsh, if I can.
Well, undoubtedly next week will be one of the most challenging in the history of the NHS. We are very aware of the strength of feeling of people working in the NHS, which is why today officials are meeting with trade unions. I'll be meeting with them on Thursday to see if there is any possibility that we can avoid this industrial action. There obviously will be a pressure on services. Clearly, there will be a need to cancel quite a lot of elective care on that day, which will cause, I'm sure, a lot of frustration for people. But it is important that we put those mitigations in place, that we do a lot of preparatory work. We have been working towards this for a number of weeks now to make sure that all those mitigations are in place. But obviously that very urgent care will be in place to cover those very serious situations. I ni'n ymwybodol iawn bod lot o bobl yn anhapus gyda sefyllfa tu fewn i'r NHS o ran y gweithlu. Dyna pam maen nhw yn cwrdd heddiw gyda rhai o'n swyddogion ni yma yn Llywodraeth Cymru, a bydda i'n cwrdd â nhw ar ddydd Iau i weld os unrhyw ffordd allwn ni atal beth yn sicr fydd yn un o'r diwrnodau mwyaf anodd yng hanes yr NHS. Felly, i ni yn gobeithio y byddwn ni yn gallu gweld gwahaniaeth, ond i ni roi mesur mewn lle i weld os modd i ni sicrhau bod pobl yn cael y gofal, rheini sydd angen yr help mwyaf, ond yn amlwg fe fydd llawer iawn o operations yn cael eu cancel ar y diwrnod.
Are you able to guarantee that no one's going to come to harm as a result?
Well, it's very difficult to give those assurances, of course, but you know, we are talking about people who go into a service because they genuinely believe in caring for people. So I know that it will not be their intention in any way to see anybody come to harm. Claire?
Thank you, Minister. So I just want to quickly tell you the story of a gentleman I spoke to towards the end of last year called Raymond. He showed symptoms of prostate cancer and he went to his hospital in North Wales and had the standard tests done. It showed there was no cancer there. However, his symptoms still showed. He was told by his hospital that he could have a multi-parametric scan, which would confirm whether he had prostate cancer. But he was told that service wasn't available in North Wales and he would not be able to go to South Wales where the service was available. So he was forced to go through private healthcare to have the scan and spend £1,000. The scan showed that he did have cancer. What's being done to stop this happening and having to force people to choose between money and their health?
Thanks very much. Well, I obviously can't comment on any individual cases, but it is important that we can offer a service to people throughout Wales, and part of the cancer plan is to make sure that there is a consistency in approach, so wherever you live in Wales, that you can expect a service to be of a sufficient quality. So that is one of the key points in this cancer plan.
And Prostate Cancer UK are still saying that it is an absolute postcode lottery across Wales for what type of care you can have and whether you're able to have a diagnosis early enough to be treatable. What's being done to end this postcode lottery? Well,
you'll see that point 5 in the cancer plan is about consistency of high quality care, and that means that we need to see compliance with the single cancer pathway that has already been established. So we have the pathway already, but what we're not seeing is consistency in terms of that approach, which is why I was pleased to host a cancer summit meeting before Christmas to look at that lack of consistency throughout Wales and to try and drive productivity, in particular in those health boards where we're not seeing the kind of performance that we need to see. Dan Davis.
Richard.
Oh, Richard.
Hi,
Sorry,
that's all right.
Richard.
Thank you,
There we
Minister. Just on strikes, you'll be aware that the fire brigades unions have voted in favour of strike action. they want a better payoff than the one they've been given so far. Just wondered what your reaction was to that and what the Welsh Government could do perhaps to prevent that strike action from taking place.
Thanks very much. Well, clearly we're all under a lot of financial pressure. Everybody is suffering with the cost of living crisis, including our own services. So this financial year, in the NHS, we were given a bill for £207 million for energy that we weren't expecting. We did get a certain amount of money from the UK government to help us with that, but nothing like what we needed to cover. And so we've had to find those savings from within the services we're given. That's true across the board. And so those inflationary pressures have not led to an increase in money coming from the NHS, from the UK government, which is why we are in this difficult situation, why people are understandably frustrated when they're seeing inflation rates at where they are at the moment, and why we think it's really important for us to continue discussing with our public services to see if we can find a way through this. You'll be aware that in relation to health and education, that obviously we are in a discussion with them at the moment for a quantum of money this financial year, but obviously those negotiations have not concluded yet.
I suppose it's more concern for people, isn't it? Many will remember that the scenes from 20 years ago with green goddesses going out to help. People won't want to see that again.
No, we haven't seen this level of industrial action for many decades. I think it's fair to say that the erosion of wages over the past 10 years, during which the Conservative government in Westminster have been in charge, there has been an effective cut in real wages, and people will remember, I hope, who was in power in UK government and understand that actually we will go as far as we can in Wales to help support people, but obviously the way that we are funded means that we only get money commensurate with what they give into those devolved services in the United Kingdom.
Diolch, Minister. You've just said that under the new way of measuring performance, you've found that performance has been far below your expectations. I mean, is that because the Welsh Government hasn't put enough emphasis on cancer diagnosis and treatment in the past? I remember in the last decade, there was quite a lively debate about whether you should have a dedicated cancer treatment fund, as had been set up by the Conservative government in England, and the Welsh Government for a long time said no because it would disadvantage people with other conditions. Does that show that you haven't put enough emphasis on this before the pandemic?
No, what's happened is we've changed the way that we count, how long people wait for their cancer treatment. So what we do is we count people earlier on their cancer pathway, and that is not something that's done in England. So we think that's more honest with those people who are suffering from cancer. So we don't count people from when they are it is decided that they should carry out treatment. We count them from when there is a suspicion that there is cancer, which is significantly earlier in the process. We think that's more honest, and that's why. But obviously, there is a consequence to that in terms of the trying to meet the targets that we've set ourselves. As we've set out, what we do in the NHS in Wales is we give the money out to the health boards, and then we set them priorities. So I've set only 6 priorities for next year. One of those priorities is cancer. So I will be expecting a real focus from NHS health boards on cancer care.
On the strikes, when you speak to the unions on Thursday, as far as we can tell, you're not going to be offering them anything different from what you've offered before in terms of money. So have we reached the point now where we just have to, or you just have to acknowledge that there is nothing more you feel you can do to avert strikes in the NHS? Os allwch chi ateb hwnna yn Gymraeg hefyd, byddwn ni'n diolchgar.
So we've been clear that we're not going to give a running commentary on negotiations. There is a quantum of money that we have offered to the unions. We're still in discussions on that. There are a couple of other issues on the table, including, for example, reducing the amount we spend on agency nursing, making sure that we look at how and if we can reform the independent pay review body process. But I think it's important that we try and keep these discussions alive. That's certainly what our intention is, and we'll be working up to the very last moment to see if it is possible for us to avoid industrial action. I ni yn ymwybodol iawn bod angen I ni cario ymlaen I drafod gyda'r undebau. Beth I ni wedi gwneud yw I ni wedi rhoi swm sylweddol o arian ar y bwrdd ar gyfer y flwyddyn ariannol yma. Dyn ni ddim yn mynd I rhoi trafodaeth manwl ar y trafodaethau hynny sydd yn digwydd, ond beth sydd yn bwysig dwi'n meddwl yw bod ni'n gwneud popeth yn gallu ni geisio atal y streics rhag ddigwydd yn y dyfodol agos. Diolch yn fawr.